Number 5 are communications between the payer and the patient. So every medical office that accepts insurance should, as a matter of course, get an assignment of benefits from the patient. Essentially, it means that the patient is authorizing the insurance company to pay the doctor directly. Let's not forget, it's the patient that has insurance, and therefore they are the policyholder of the insurance company, and therefore arguably they should be paid unless they sign an assignment of benefits to the doctor. If the patient does not sign the assignment of benefits, then the patient may very well receive the check. It also shows, at least in the cases where an assignment of benefits was supposed to be signed and wasn't, it shows the medical billing company that the operations of the medical office need to be tightened up, because it stands to reason that if they miss assignment of benefits, they're probably missing other things as well. Now, irrespective of whether the patient did or didn't sign the assignment of benefits, and whether or not they receive the check directly from the insurance company, the patient will also receive an EOB of the claims paid or denied with the reasons. Essentially, they receive substantially the same EOB that the doctor receives. Please note the designated area on the flowchart. Number 6, communications between the biller and the patient. Billing companies can contact patients when money is owed to the doctor, and typically the money falls into one of 3 different categories. The first category is a copay. Essentially, that means that the patient has to pay, based on their insurance plan, a certain predefined amount of money for a doctor visit. It used to be $5 copays, then $10 copays. Now $20 copays are not uncommon, and we've heard of higher copays than that. As an aside, the rationale of the insurance company is that the more a patient has to pay, the less often they will run to a doctor. The second way in which a biller may have to call a patient is for a deductible. There are many insurance plans that require the patient to pay the first specified amount of money before any insurance coverage comes into play. It could be $250, it could be $500, or it could be in the thousands of dollars. Typically, doctors' offices are supposed to verify that there is no deductible liability before they see a patient. However, like many things in life, it's not always perfect. And if the doctor's office did not verify that there's no deductible, or they did not collect it at the time of the encounter, it usually ends up at the billing company's desk to try to collect. The third is coinsurance. And while that's a little more complicated, it really is the balance pending after the insurance company pays. Now, in most cases, if you go to a doctor in your network, then there is no coinsurance, because by definition, the deals that insurance companies make with the doctors in the network, meaning the doctors with whom the insurer has a contract, say that the patient is not responsible for coinsurance. The patient will be responsible for copays, the patient will be responsible for deductibles, but the patient will not be responsible for coinsurance. Coinsurance comes up in the context of either going to a doctor out of network or having a treatment by a doctor that is not covered by insurance.
So if the insurance policy does not cover that particular treatment, the patient may very well be liable for the coinsurance or for the totality of what is owed.
In fact, most doctors' offices have patients sign a document setting forth who is the responsible party for monies not paid by the insurer, so that they have all of the T's crossed and the I's dotted. The way in which the communication occurs between the biller and the patient is that the communications are either mailed paper statements or telephone calls. But in either case, the typical practice is that the medical billing company does not identify themselves as a medical billing company, but rather that they are calling on behalf of the doctor's offices. We can get into the reasons for this as we go at a later presentation into greater detail of the medical billing practices. Please note the designated area on the flowchart.